welcome to another electrifying interview on Spark Igniting Minds. Dr. Srivats Bharadwaj, a seasoned entrepreneur and pediatric dental specialist with over 27 years of experience, has pioneered innovations in healthcare to enhance patient outcomes. Founder of the Vatsalya chain of dental clinics, he is dedicated to bridging technology and healthcare, shaping policies and mentoring future healthcare leaders. Dr. Bharadwaj's influential work spans clinical practice, teaching, and extensive community outreach. Today, he joins us on Spark Igniting Minds to share insights from his illustrious career and his vision for the future of healthcare.
Namaskara, Dr. Srivats Bharadwaj. It's a pleasure having you here on Spark Igniting Minds. And with this interaction, I think we can explore more about your insights, experiences about dentistry and also pediatric dentistry.
Namaskara. Thank you so much for inviting me, Sahana. It's always a pleasure to share views, insights, and what I probably think should be the future of oral care and how it generally impacts our lives, quality of lives, and also the general health of people and population at large. Thank you once again for inviting me.
So with this, I would like to ask you a question, sir. You have been in this field for almost 27 years in both preventive dentistry and also as a pediatric dental doctor. So how did this field evolve? And what do you believe are the significant changes in the pediatric dentistry?
It's a very nice and intuitive question. So if we go back in the timeline or the history of dentistry, pediatric dentistry as compared to many other fields is a far more recent development, and the focus of pediatric care came into being with the philosophy where we thought, can dental problems be prevented? Because there is no end to curative care. You can keep on doing stuff, you can keep on doing surgical interventions or treatments, but then by and large there is only that much that you can do. So oral health defines a lot of quality of life for persons. If you look at statistically, you will find that people lose millions of work hours because of dental issues. People lose a lot of productive life because of dental issues. A lot of financial burden comes into, because dentistry is a very expensive therapy or a treatment to avail. Given these reasons, I think we all looked at what is it that can happen to prevent a person from losing his health, prevent a person from losing his office work hours. Or if you look at school children, the number of school children who miss schools because of dental pain is enormous. And hence there was a focus on pediatric care. So is there a way that we can do something when people are younger as children so that they never develop a larger problem going forward? Secondly, one must understand that why is it important to inculcate the behavior of good oral care as early as possible as a child is because it's a behavioral issue. I cannot teach you how to brush today. I can teach you, but for you to follow that is going to be that much more difficult because you're used to traditionally doing what you have been practicing. And so if we are able to get the right focus, if we are able to put the foundations of oral care, which is preventative, and that can go a long way going forward. So this was the philosophy with which pediatric dentistry evolved. And going forward, what I see very largely is that the awareness levels of people is drastically increasing. Previously, there was this concept that people would think that, oh, it's milk teeth, we really don't need to worry about it. When permanent teeth come, we'll take him to a doctor, and so on and so forth. But I think more and more people are now recognizing the truth that if your foundation is not so strong, it's the same analogy like Would you think that I want my daughter or son to be a doctor or an engineer or an artist and not send them to school saying that I'll send them directly to that professional school? It's not possible. The foundations have to be built on in the right way. They need to understand what is art. They need to understand how to approach science. They need to understand what are the basics. And hence, it is very important that even milk teeth are protected, because milk teeth form the foundation of your mouth. They form the foundation of your habits. They form the foundation of your general health. A lot of children and adults who are suffering from general health issues, sore throat, this, that, so many of them, the infections are sitting in the mouth.
So at what age do you think that they should start taking care of oral health?
I think it should be on day one.
Day one.
Day one.
Okay.
So on the day one of the birth of a child, there has to be a pediatric dental examination that has to happen, because it's not just about teeth. Oral health is not about teeth.
Not just after the milk teeth.
No.
It is even before that.
Absolutely. So oral health is not about teeth. Oral health is about oral hygiene. And when we speak about oral hygiene, it talks about lips, it talks about the cheek, it talks about the tongue, it talks about the palate, it talks about the entire surface that's inside the mouth, as well as everything that gets related to the head and neck region. So it's a very important aspect. And so a very important advice to young mothers is that the day one that you have a baby, it should be examined by a dentist, especially maybe a pediatric dentist. And oral care regimes must start, which is you start feeding your baby. Every time you feed your baby, make it a habit that you actually tie a soft linen cloth, have a small bowl of lukewarm water, dip your finger with that linen cloth and clean the gums, the lips, the palate, and
the complete oral cavity.
Exactly, oral cavity. So there should be no retention of any feeding fluids in the baby's mouth, because that is the breeding ground for bacteria to grow. And so you will find that a lot of young children, as soon as the teeth comes, the teeth are already destroyed with decay. That is because these bacteria are waiting to go ahead and attack those teeth. And the protective layer of our tooth, which is the enamel, which is the hardest or the strongest structure in the entire human body, fundamentally is very thin in kids. And so it rapidly destroys. That is why you will see a pattern like a wildfire that happens in a child's mouth, that all or most of the decays will eat away the teeth within 3 to 6 months, or maximum in about 8-9 months. And it's very, very difficult for you to take that child and treat them, because it's an emotional decision. You have to put your baby through a lot of torture with so-called anesthesia, so-called procedures like root canals and things like that, that must be performed on such young children.
That is very painful.
Absolutely. It's just not painful physically, but it's also emotionally draining. And don't assume that doctors are not human beings. The same emotions go through us as well, because we also find it very hard, but then you have to separate yourself from that and do good, what is the most best important thing that is required for the child. So in the larger good of the population, as well as from a prevention perspective, it is always best to follow these certain principles which cannot get you there. So don't remain ignorant.
Most of us don't know that it should start from day one.
Absolutely.
Even the milk teeth will not be taken care of at all.
Absolutely. So every feed that you feed your baby, immediately make sure that the mouth is cleansed. There should be nothing that is lying inside the mouth there. If you ask me a primordial preventive advice, this is after the baby is born. A primordial preventive advice I would say is that even before you have your baby, the first thing you must do and your husband must do is go completely get your oral health sorted, because that is where bacterial transmission happens. So both the husband and wife should make sure that all their cavities, all their gum issues, everything are treated properly, and then they plan pregnancy.
Transmission of the
Well, no, there's no such thing, but I'll tell you something more interesting. So what happens is that the oral hygiene of the parents is extremely important for even having a healthy baby. because if the mother's oral hygiene is poor, then there is a larger risk of delivering a preterm or a low birth weight baby. And that's a very important aspect to realize. So prevention begins as early as that. Second is during your pregnancy, ensure that there are 2 dental visits at least where you go ahead and get a simple cleaning done. Because that will prevent you from having a lot of gum issues that will develop because of pregnancy and the hormonal changes that you go through. And so oral health is an extremely important aspect when it comes to your general health, well-being, and also your kids' care.
And doctor, is there any connection between oral health and the general health? Is there an impact on the general health?
Oral health is the absolute killer when it comes to general health. So most of us do not know. Somehow this whole practice and philosophy that dentistry is divorced from general health is a concept that has evolved thanks to the probable education system that we have in, because dentistry is aligned as a separate branch, and then the medical guys who study it are not well aware of what are the oral health implications that has to happen. So first thing first is that we need to integrate this, not just in studying but also in practice. And that is very vital, because most people think oral health is some mechanical stuff which just will be taken care by brushing, and I don't have pain so I don't need to go to a doctor. And that's the primary philosophy. Dental issues by and large do not cause you pain or discomfort until you have reached a substantial end stage disease. And that is why you hear about everybody wanting a root canal or a removal and an implant or a bridge. But you can completely avoid that. 98% of dental problems are preventable just by making sure that you take good oral hygiene practices at home, maintain a very good diet protocol, which is oral health friendly, and also making sure that your stress levels are not increasing day by day. Because stress has a very important factor in oral hygiene, and oral hygiene has a very important factor from your general health perspective. So just to give you an oversight, if you have poor dental hygiene, you are at 3 times more risk to develop a stroke, heart attack, respiratory or lung infections. Women can deliver preterm low birth weight babies. Even if you're going through any regular surgery, first thing you must get is a dental clearance. You should not have a nidus of infection or a foci of infection anywhere in your mouth. Cardiovascular health or heart health is completely determined and governed by the oral health status of your mouth.
So that should become a part of the, when you go for a surgery, that should become a part of the routine.
Absolutely yes. Absolutely yes. And it's just not that it should be a part of routine, but I think it is very difficult in these times of the way the practices have been set, because we are so much so super specialized. Everybody is a super specialist and a subspecialist. And the problem is that the focus is entirely on that one particular area that we do. I always wonder how would it be if a football match is going on and the goalkeeper says, I will only look at it when the ball comes near my goal post. I'm not bothered about what my front guys are doing or the midfielders are doing or the defenders are doing. If you look at a match that is played as a team sport, everybody contributes. And what the person at the goal post is seeing is not seen by the front guy. So he's ready to pass on that information saying, turn this. So you'll find all the goalkeepers actually guiding the whole thing. And that is the way medicine must be practiced. And unfortunately today it is so much so disseminated that I will say, no, I'm the finger specialist of
the general medicine and the oral medicine.
No, even absolutely. Even in general medicine, it is probably getting to that where I'm just saying that I'm only focused about my thumb. I am only a thumb super specialist. I don't know what's happening with your wrist. And that's the unfortunate reality, and that's the bane, the way things have been set up. And most doctors, all of us, somehow have been evangelized to believe that you have to do more and more procedures, that you have to be somebody who does something, and that kind of gives us a kick. But people are forgetting the fact that the greatest the greatest benefit of being a doctor is not to create more disease or not to treat more disease. A doctor should be paid the maximum when the population has less disease.
As a preventive
exactly
measure. Yes.
As a measure, we must actually be focusing on how can I prevent disease, how can we see population productive. Imagine we are talking about countries' economic growth, we are talking about the countries, we are going to be third most richest nation and XYZ $1 trillion nation and stuff. How are we going to achieve that if the health of people are going bad? Right on this road, if you look at, we have 5 corporate hospitals, all of them are full, right? 20 years ago that didn't exist. I'm not saying disease didn't exist, but we have forgotten the functional aspect of the human being. None of us are practicing functional medicine or functional dentistry, which means that we have to look at a problem from an overall perspective of the entire body, the entire system, and what each one of them contribute or impact the other one. And the more we focus on prevention, our population is healthy. Healthy body gives healthy mind gives productivity, economic growth, all of that will happen. Otherwise, just imagine the amount of dependable people that we are having at homes, and so many homes are starting off for senior care living, assisted living, nurses at home. So this is an indicator for all of us that we are going probably in a very wrong direction. And medicine or healthcare is not about doing procedures, it's not about treating disease. It is about making sure that the person remains healthy and productive, not making them vegetables. If the society is healthy and productive,
naturally it has an impact on the economy and also the progress of the country. Yes.
2 most important factors to me. If you want to be progressive, whether economically or anything, your health is important. If you want to be happy, your health is the most important thing, right? What are you going to do with all the wealth and name and fame if you don't have health in your side? And that is what is lacking today. And unfortunately, you go and take 10 opinions from doctors, all of them will give you the same standard opinion. How are you going to make a decision? Which doctor am I going to choose my treatment from? Because
nowadays, everything has become specialization.
Exactly.
There is no holistic treatment at all.
Exactly. And then, unfortunately, the systems are also different, because it's not just from one side of the medical practitioners. They are a small contributor to this, but the larger contributor is also the responsibility of the citizen or the population at large, as a human being, as a patient, or as a person who cares about his own health, to do proper research about what is it that I really want in life. And then also we are not diligent enough to follow standard advices that are also given. We will go ahead and do everything that is possible and then take the whole blame and put it on a system or a doctor and say that you could not cure me, you did not do me this and that, right? So that is the burden. So it's a two-way seesaw that is continuously happening.
Doctor, what do you suggest like for the general people? Should they go for oral checkup every month, or once in 3 months, or once in a year? What is your suggestion for them?
Very nice. So I would strongly recommend a dental check every 6 months. Do not confuse a dental check to a dental cleaning, because there are a lot of places and countries where people say that every 6 months you need to come and get a dental cleaning done. That's not required. Because if you're fundamentally getting your mouth cleaned every 6 months, it means that you're not brushing well at home. It's like you sending your car for a service once every year. They'll wash it and get it for you. Next day you have to wash in your home. If you don't do that, and simply by sending the car for a service every 6 months or a 1 year, you cannot expect anything good to happen. How you drive it every day matters. So oral health is like gymming. You cannot just lift weights of 20 kilos today and expect that you're going to be fine tomorrow morning. No, you have to have consistency. It's a behavioral change that has to come in, which includes your physical health, which includes your mental health, which includes the habits that you have in terms of your diet and the lifestyle that gives you stress. And these are very large contributors. So oral health in my prediction, is going to be the next big thing that is going to take a sweep at the way healthcare and population is at large.
That is fantastic, doctor. The way you have emphasized on the importance of oral health, that we should really take it as a habit. And
Oh yeah, absolutely.
yes. And according to you, what is dentistry as a profession? For the layman, what is dentistry? And even for a student professional, what should dentistry mean to them?
Very, very good question. So I think for a layman, dentistry should be the first point of contact.
Okay.
Even if you look at old time doctors, like when I was a kid and I would visit a doctor, the first thing the doctor would do, if I would say even I have fever, they would check my mouth.
Okay.
Right? Because there are more than 120 conditions or diseases that can be found out just by an oral examination. There is a specific pattern that we will see in the mouth of a particular disease.
Yeah, if there is a fever, there is a change in the mouth,
Exactly.
even the odor that comes out of the mouth.
Exactly. And there are many other signs that professionals look for. So from a very layman perspective, I would think that you must understand this, that the largest entry of any infection into your body is through the mouth. Right? Because you have the only portal of entry which is easily vulnerable is our mouth. Second, it's a beautiful cave which is dark, dingy, and has crevices or grooves where food and bacteria can get entrapped, easily enter into your gums or through our teeth and get into our general body circulation. So a lot of times you will find that dental infections, if you match the bacteria that has infected somebody's heart versus the bacteria in the mouth, they would match. And so if you need to live a good, healthy life, the most important factor is your oral health. Because our saliva also plays a very important defense mechanism in preventing all the bad infections that we can get. And unfortunately today what we are doing is we are getting into practices because we are being swayed by advertisements of oral, mouth washes and toothpaste and so many other things which are actually harmful. So I would strongly advise that people do not fall for these gimmicks and actually ensure that they don't get into these practices which can cause you more problems than good. Because they actually take away your oral immunity. They will in fact cause disturbances even when it comes to your taste buds. They are probably at the forefront of causing oral cancers. Not just that, but I also read very recently that your cardiovascular health, including your hypertension, is related with alcohol-based mouthwashes that you're using on a regular basis. Okay. So imagine the impact. So for a layman, I would strongly say the day your mouth is healthy, your body is healthy. Because do not forget, your gut is an extension of your mouth.
Yes, correct.
Right? It's no different. So all the research that is leading to gut microbiome today is coming back to focus on oral microbiome.
Okay.
And so if you have a well-balanced, healthy mouth, then you will have your entire system in place. A lot of your digestive issues, respiratory issues, cardiac issues, like I mentioned, stroke, heart attacks, all of this can be prevented if you have good oral hygiene. And the responsibility is in you, that you have to ensure. Now it's a different thing to keep debating oral health is expensive, dentistry is expensive. Yes, it is. There are people, and I am most willing to work towards how do we make it efficient, not by reducing quality and transmitting infection, right? But how is it possible that we can make oral care more affordable, more outreachable, and all of those things? That's a debate for another day. But having said this, it is our primary duty that this is the cost that it costs for me to take care of my oral hygiene, and I must have that mindset to take care of it. You cannot say that, oh, car is expensive, bike is expensive now. You need it, you have to buy it. But prevention is inexpensive.
Prevention is better than cure.
Yeah,
If you
is
prevent,
exactly.
you
So
are healthy.
exactly. So learn the right way to brush, rinse your mouth well, eat the right kind of food. When I say the right kind of food, it's not about not eating junk. A lot of people have this myth that sweets and chocolates cause tooth decay. They don't.
They don't.
When I say they don't, it is not that they only cause. You can be a rice and a roti and a chapati dal eater every day and have a full mouth of tooth decay. It is about the time that you eat what you eat that matters the most in your mouth. So good dietary patterns with the right timeline that is slotted will give you optimal good oral hygiene. And I re-stress always that stress is a killer. Stress is a burner for oral health as well as your general health. So make sure that this is it. As far as what does dentistry mean to a student of dentistry, I think one should be very inspired today, because when we started practicing or when we started studying dentistry about 35 years ago, when I started doing that, there was limited access to knowledge. There was hardly any innovation. There were only routine procedures that were being done, and it was more of like, oh, you have a toothache, we'll take off your tooth. That was the kind of trend and philosophy that was by and large practiced. And more importantly, there was almost zero focus on infection control and hygiene. Why is infection control and hygiene so important is because in a dental clinic or when you go for your dental treatment, the least you can actually transmit to your patient or a patient can acquire from there is a HIV, hepatitis, tuberculosis and all dreaded infections, because every single procedure as simple as a cleaning actually has connect or contact with blood. So it's extremely important that students of dentistry focus that this is a matter of high level science, and they should approach this whole subject with a scientific acumen. They should approach this with an integrated acumen that how is oral health going to impact my patient's general health and hygiene, and what is it that I need to be prepared for actually as a dentist. Most unfortunate thing is that we find a lot of parents admitting their kids into dentistry because they feel that dentistry does not have emergencies, which is the first lie. 100% of people who get dental pain get it only at night when they are sleeping. Second myth is that they feel that it does not have night duties or emergencies and surgical interventions that are required, so they can open a small shop and then open and close as and when they want. This fundamental approach needs to change. This fundamental approach needs to change, where a person should never enter this field considering these things. You've been in the defense sector, as I know briefly of. Like an army guy who goes there doesn't think about whether I'm sleeping here in the middle of the night, where is my bed and bedding, will snake come and catch me and stuff like that, bite me. No, you're focused about your goal. You think about the ways you can mitigate stuff, but you are there all the time with your focus. And that focus is extremely essential, not just to a student of dentistry, but to any student. And it's more important when you're a student of healthcare, because if you don't have that quench, if you don't have that desire, then you can never progress. The last thing is, dentistry is the most difficult science to practice, because it's not just knowledge, but it is a common sense factor that has to come in, plus your hand skill. So people who do not have the artistic bent of mind and the ability to be an artist will fail significantly as a dentist, because the ability to look at precision, the ability to look at fineness, the ability to look at how nicely I can work, because imagine if I have to see as a pediatrician,
have the same skill as of a surgeon.
Exactly.
General surgeon.
Much better than that. Much, because a general surgeon has the luxury of operating under general anesthesia. In no way I'm demeaning that. But what I'm just comparing is, we don't have luxury of general anesthesia. It's local anesthesia. We don't have the access into the mouth. We actually have to peep into somebody's mouth. And the maximum opening that we will get is probably 1 centimeter. Imagine if I have to operate on a child who is, let's say, 1 month old, 3 months old or 4 months old, my finger would be the entire mouth.
Your finger is much bigger than
right?
the
And imagine the anxiety not just of the patient but also of the patient's parents and the attenders and everybody in oral care, right? They're anxious for some reason and we have no access to seeing what, and the drills and other things that we use rotated lakhs of rotations a minute, which can, if you just move, it can just tear into everything.
Should be very, very precise.
Exactly. Exactly. So it's a field that requires meditative focus. It requires enormous amount. So it's a very, very easily burning out kind of a profession. You get dentists are the people who have the highest amount of stress and burnout compared to any other medical professional, because the expectation of a patient is large. We don't have the luxury of anesthesia.
Because usually we get scared to go to get dentals.
Yeah, most people
removal is most painful.
Yes.
And then even the
Absolutely.
root canal.
Absolutely. And the general population's thinking is, oh, this is just a dental thing. Even general population doesn't look at this as a whole science as medicine.
We never had an idea that oral health is so important and it really affects the complete general health.
It's one of the biggest killers for all of this, and it's time that people start speaking about it, people start knowing about it, and people start implementing these things.
Even doctor, women, most of the women join dentistry, I have seen. Because if they don't get into the mainstream of MBBS, the next option is to go as a dental doctor.
Yeah.
But then I haven't seen them continuing their profession. And what would you like to say about women in dentistry?
Yeah, actually on one side I feel that dentistry is one profession that has empowered women so much.
Yes.
Because almost 90% of dentists are women. And it's such a great thing. But in some of the interviews that I've always conducted with students, and when I find out why did you join this, 90% of the times the answer is that I did not get medicine, so I joined dentistry, which over a period of time will change when science comes in. Today it's just people are thinking it's like carpentry, which is not the fact. There's a huge science to it. That'll change, I'm 100% certain. Second is, I think the mindsets of parents who look at dentistry is also going to change, because parents think that, like I mentioned, that this doesn't have emergency night duty and you don't need to be full-time there. These are myths. Actually, it's not so. The unfortunate reality is that women join dentistry, and then if you're joining a profession with this attitude, how will even the profession progress? So on one side, I keep telling that, patients must be educated about all of these things. But if the dentist itself is not passionate about his profession, how will patients get access to the right kind of information and right kind of treatment, right? And that's the unfortunate reality which has to change, that dentistry is a full-time profession which requires as much or more dedication than any other any other health, general health profession. And the day women put their foot down and say that my profession is great, I will practice this, and it's not a migratory profession. The unfortunate reality for a lady is also factual, that they are so dependent on their spouses, on their jobs, wherever they are transferred, they just have to leave and go. So they can never make a mark. Second is pregnancy that comes in. It's a great thing, but my advice is that do not quit the profession for this. Take a sabbatical, come back and get back to work and practice, because if Indian Army can have women, why not dentistry, right? Full time. That's the way we should look at it. And so my suggestion to all women is, if you take a long break, you will find it that much more difficult to come back, because your hand skills would have gone away. It's like, imagine if you have not cooked for 5 years and suddenly I let you into a kitchen, you're going to find it hard, right? And this is precision skill. And then the science would have advanced and you will have low confidence. 100%.
Yes.
I have found women to be the best doctors, best leaders.
Because they are very skillful in their hands.
Absolutely. No two ways about it. No two ways about it. Yes. Women are very good in dentistry because they're also very compassionate. They also are they come across far more gentle, and they have fine skill sets. And they are actually, women are multitaskers. Men are not. Women are multitaskers according to me, and hence dentistry requires a lot of manual dexterity at the same time when you're working, and they're very, very skilled at it. So I would encourage that women don't take large sabbaticals, just quit the profession and things like that. Stick on, and this is a profession that is going to be the future of care or healthcare in around the world.
And also it should become a part of the
Mainstream.
mainstream medicine.
Yes.
Instead of just keeping it away from.
Yeah, I would strongly urge policy experts to actually look at this aspect and change this.